South Africa is facing growing pressure in the battle against internal and external parasites with serious implications for animal health and the agricultural economy. Ongoing challenges, including outbreaks of foot and mouth disease, have highlighted vulnerabilities in disease control and biosecurity measures across the country. As the livestock industry works to contain these threats, we are now joined by Dr Dave Midgley. He's the CEO of the Ruminant Veterinary Association of South Africa, to unpack this a bit more further. Dr Dave, thank you so much for your time this evening here on SABC News. Perhaps let's start off here. I mean, we've heard the interventions this week being announced by President Cyril Ramaphosa when it comes to this threat of foot and mouth disease, and of course it has now been declared as a national disaster. What is your take on the latest bout of foot and mouth disease in the country?
Good evening or good afternoon. Yes, foot and mouth disease is a national disaster. The disease is really just about out of control in certain areas. Families are being affected, livelihoods are being affected, because animals are being affected. Mostly cattle, although other species of animals are also affected. All cloven-hoofed animals like sheep, goats, and of course wild animals were mentioned earlier on. Special concern, of course, are buffalo, but let's leave the finer detail. The Minister of Agriculture and obviously the President made very important announcements the past week, and I think we must concentrate on the positive. The most important thing is that vaccines are going to be available pretty soon. As early or during the past week, additional vaccines, and we're talking doses of 5 million and another 5 million from two different companies that have been approved. There's still a time, of course, between approval and getting the vaccines. But if we are looking at around about 10 million vaccines that should be available within the next 4 to 6 weeks, the problem that arises is getting those vaccines into the animals. And that is where Ruvasa, amongst others, plays a very important role, where private veterinarians can assist the state veterinarians in getting as many as possible animals in the most important or high-risk areas vaccinated.
And what would you say this has been the impact on when it comes to farmers, and also when it comes to consumers at large, particularly where it has been largely affected? I know that issues are as well in the Eastern Cape, where the outbreak really has been very difficult to contain. So when you look at the impact, how has that impacted farmers and particularly consumers?
I think the important thing to know is that for a period of, say, 40 years, the disease was contained to the Kruger National Park and surrounding areas, whereas for various reasons it has jumped into KZN and into Limpopo province. Free State is particularly badly affected. And the one outbreak that we had in the Eastern Cape was pretty well contained. But over the festive season, new outbreaks have popped up. And now also in areas where we never had the disease before, like the Southern Cape and Western Cape areas. The last province was the Northern Cape that in the last 2 weeks we've had positive cases as well. So the disease is across the country. And the biggest problem was that nobody was really prepared for the total extent of the disease. But how does it affect us? Families at the moment, animals may not be moved. Being a national disaster, we are looking at control measures, and the most important being movement and or trying to limit the spread of animals, because animals, infected animals, and even in the incubation period before they get show symptoms of lameness and of salivation. Remember, the disease is called foot and mouth disease. The animals are already contagious, and by moving them, they can infect naive or susceptible animals in other areas. And that has been the most important way of transmission. So what has happened now is that when a farmer is found to be positive, with the old regulations, and I say old regulations is we are still bound by the Act, the Animal Diseases Act of 1984. In which we were actually still regarded as a clean country internationally without vaccination, whereas at present we are actually trying to strive to become clean again with vaccination. So how does it affect everybody? Once you are affected, and even when we were vaccinated, or the animals were vaccinated, you could not move the animal freely to a sale, and that affected, it's the beginning of the year, school fees has to be paid. After Christmas, our pockets are empty, and we know that especially communal farmers, their animals is their bank. And with movement restrictions, in place. The most important thing is that the recent recommendations by the Prime Minister that we are now in a situation where sorry.
And unfortunately, Dr. Dave, we have run out of time, and thank you so much for that insight and for weighing in on this very important topic facing many farmers and in turn will be facing consumers in the country. And that's Dr. Dave Midgley, CEO of Ruminant Veterinary Association of South Africa, there unpacking for us the issue of foot and mouth disease in the country.